The COVID-19 vaccine rollout in developing countries has been stunted by the pharmaceutical monopolies on production, according to the Health Justice Initiative's Fatima Hassan. She joins us now to discuss this further. Thank you for your time, Fatima. Just wanted to ask, you're not trying to give the South African Department of Health a get-out-of-jail-free card. They haven't covered themselves with glory, have they, either?
No, definitely not. And I think today's news about the different issues affecting the pace of the rollout of South Africa's vaccine program is obviously a cause for concern. But South Africa, like almost all countries in Africa, as well as the rest of the developed world, are still waiting for sufficient supplies of vaccines from a handful of companies who are considered the front-runner vaccine companies. So if those companies had shared the knowledge earlier, were willing to transfer the technology, were willing to introduce multiple manufacturers into the system, I don't think we would be having the supply constraints that we're currently facing. So in a pandemic, when you limit the number of people who can actually make a vaccine that has been proven to be safe and effective and life-saving, it does mean that you're going to have significant delays in supplies, which is affecting South Africa and, like I said, the rest of the developing world. But it's also affecting a mechanism such as COVID, which is saying that they don't have sufficient supplies to support low and upper middle income countries.
Yeah, I'm glad you mentioned COVAX, because we paid some 280 million rand some 6 months ago, haven't received a single dose yet. And, you know, they had all their eggs, I think, in the AstraZeneca basket coming from the Serum Institute. Is that the problem with what happened with COVAX?
So, yeah, definitely, you know, one of the key parts of the COVAX mechanism was to rely on the AstraZeneca vaccine, which in turn was going to rely on the Serum Institute of India, which, as we know, is having multiple constraints in terms of being able to both manufacture and send supplies outside of India because of the really dire situation in India. But again, that's also because AstraZeneca refused to give multiple licenses to other manufacturers and kind of limited it to, you know, a handful of companies that clearly can't meet supply needs. But COVAX is also relying on Pfizer and has a few other companies that have now made some commitments which we believe are obviously insufficient. They're not enough. We certainly paid for joining COVAX as a self-financing, what we considered as a middle-income country for the purposes of COVAX. Nobody has seen that contract. We've made a down payment. We haven't received a single supply from COVAX for the Pfizer batch that was ordered. We do know that a request was made to COVAX to swap the AstraZeneca vaccines for another vaccine, which in this case is probably likely to be Pfizer, but none of those supplies have arrived. So we're in the middle of quite a serious supply crisis, and the factors for that are multiple, and, you know, the blame for that lies at the feet of many different role players, but in this case particularly the drug companies who are still hoarding knowledge in the middle of a pandemic.
But name the other role players who are responsible, because the WHO seems to be toothless. It's not able to, I mean, COVAX was part of its conception. It thought of the idea to help developing countries through this kind of facility, and yet it hasn't worked. Why are they so toothless?
So I think it's because of the way global power works and, you know, who you give authority to. And it's been one of the ironies of this pandemic that the solution to our supply crisis and the solution to taking, you know, many parts of the world outside of this pandemic is actually now resting with the World Trade Organization instead of the World Health Organization. I also think there was a bit of naivete among some of the players that decided to set up COVAX because they really genuinely thought that there would be so much solidarity, that there wouldn't be vaccine hoarding, that there'd be sharing of knowledge, and that there'd be what they regarded as voluntary cooperation within that mechanism. So they've been fearful of calling out the pharmaceutical companies. They've been quite deferential to those interests. You must remember COVAX is also run by Gavi, which is a private foundation based in Switzerland. You know, it's not really accountable to us. And so when it fails to deliver, you know, the question is, where does the South African who has, you know, the benefit of the Constitution go to? Similarly with Pfizer or Johnson & Johnson or the AU vaccine acquisition task team, for which we also meant to be getting some supplies. It's really just the pandemic of a lot of private sector power and very little transparency and sharing of information.
So Fatima, what must we do now? Because this is not the last pandemic. We've learnt about all of those issues that you've told us. How are we going to disrupt and upend that so that it doesn't happen again, or that we can get things moving during this pandemic faster? What can we do right now?
Yeah, so we are really fearful that no matter how much evidence there is of what the consequences are for hoarding knowledge in a pandemic, despite the accelerated vaccine research which was publicly funded, that people are not really realizing the seriousness of, what is at hand. And we're seeing that still with the negotiations at the WTO about the TRIPS waiver proposal. So I think it's a combination of, total relaxation of intellectual property, compulsory transfer of the vaccine know-how, knowledge, and the technology, and a real massive urgency and investment in scaling up manufacturing around the world, because at the moment we need billions of doses, and that's simply not in the system. So relying on COVAX, relying on a few donations from the Biden administration or another country or China or Russia is certainly not going to be enough. The WHO has, for example, said we should at least prioritize vaccinating all healthcare workers and people over 80 around the world. It seems that governments are not really listening to that. So unfortunately, we're subject to a process where people are still talking around the table. It's being left to diplomats, it's being left to trade delegations, and meanwhile we have a global public health crisis.
Thank you very much for your time. Fatima Hassan from the Health Justice Initiative. Essentially, she's saying it's up to you, citizens of your countries, to put pressure on your government to get them to put pressure further up the chain.